Los invitamos a ubicarse en sus asientos porque en instantes estaremos dando inicio a este segmento de alto nivel.
Please be seated. We'll be soon starting this high-level meeting.
En este momento hace su ingreso el señor
Mr. President of Colombia, Gustavo Petro is entering this Health&Energy room in the city of Cartagena de Indias.
El ministro Jaramillo.
Pueden tomar sus lugares, por favor.
Can be seated now. Good afternoon for everyone. We greet you from the Health&Energy room from a convention center of the city of Cartagena, and we want to give you the warmful welcome to this segment of a high-level conference about air pollution and health, which is led by the World Health Organization, WHO, and is aiming to accelerate actions for a cleaner air, energy, renewable energy action, and climate change mitigation. This event is done with the participation of the President of Colombia, Mr. Gustavo Petro. Therefore, we want to greet everyone and all the representatives of the 16 nations around the world, of all the regions in Colombia, and those of you who are with us in person, and as well as the audience added to this transmission from the institutional channel and from all the presidency channels. We want to tell you that during these 2-3 days from the World Conference about Air Pollution and Health, different key topics have been addressed about the risks for health derived from atmospheric pollution, as well as the benefits of adopting measures to struggle against pollution and favoring measures to clean air, and also strategies to mitigate the footprint, atmospheric footprint, and the development of financing mechanisms to drive measures to address pollution and guarantee an just energy transition. With no further ado, we want to start this segment, high-level segment, inviting you to stand up to sing the national anthem of Colombia.
Pueden ocupar sus lugares.
Please, you may be seated. Okay, we will be starting the interventions and the words from experts, so we want to invite you to watch this video by the General Director of the WHO Health Organization, Dr. Tedros Adhanom Ghebreyesus.
Honorable ministers, distinguished partners, dear colleagues and friends, buenos dias. I thank President Petro and the government of Colombia for their leadership in hosting this important conference and for commitment to the health of people and planet. I regret that I cannot be with you in person, but I am with you in spirit as we tackle one of the greatest health and environmental threats of our time, air pollution. The simple act of breathing is fundamental to life, and yet, for many people, the air they breathe is the cause of death. Every year, air pollution claims the lives of around 7 million people. It's a silent killer, increasing the burden of respiratory, cardiovascular, and other non-communicable diseases. It disproportionately affects the most vulnerable communities and worsens health inequities. It impacts children's health and development. The same emissions from smokestacks and exhaust pipes that are choking our planet are choking people, filling their lungs with deadly toxins. Air pollution is not just an environmental issue. It's fundamental to public health. WHO is committed to supporting countries to clean their air alongside partners, the scientific community, and civil society. Air pollution is everybody's business. None of us can meet this challenge alone. It takes collaboration across the health, energy, transport, agriculture, and other sectors. Organizations of health professionals, patients, advocates, and civil society organizations around the world, representing more than 47 million people, have signed the call for urgent action to reduce air pollution and protect human health from its impacts. Now, our collective task is to turn this call into action. Last month, WHO's Executive Board agreed to a new global target to reduce the health impacts of air pollution by 50%. We estimate that meeting this goal could save around 3 million lives every year. I urge national and city governments, along with companies and corporations, to commit to this target and take decisive steps toward cleaner air and a healthier future. It's time to move from commitment to bold actions. That's why I invite all of you to join us in taking concrete steps towards reducing the health impacts of air pollution by 50% by 2040. This is an ambitious goal, but an achievable one if we act now. Let me highlight 3 areas of action from both the public and private sectors. First, we need financial action to invest in clean air policies and sustainable energy. Second, we need technical action to translate guidance from WHO and national and local authorities into laws and regulations to reduce emissions. And third, we need social action to protect the most vulnerable populations in the most polluted regions. Thank you all for your commitment to working together for clean air and energy for all. Together, we can give our children, our grandchildren, and generations to come the chance to breathe cleaner air. Muchas gracias. I thank you.
Thank you so much to Mr. Tedros. Now we want to invite the Director of Public Health and Environment from the World Health Organization, Ms. Maria Neira, Dr. Maria Neira.
Señor Presidente, querido ministro.
Mr. President, dear Minister, dear participants, excellent representatives from governments, institutions. Mr. President, thank you so much for this message. You are giving us, with your presence, a message that gives relief for those of us who are struggling for air quality, that reaffirm our decision to choose Colombia and this wonderful city of Cartagena for the place where the conference is being held. Mr. President, here you have more than 700 people that have traveled from many places around the world, representing more than 60 countries. But you also have, behind all of this, 47 million of voices, 47 million of health professionals from different health scope, because we are all health, getting together for this call and are asking us to raise our voices higher and more ambitious, they struggle and thrive for clean air. The willingness moves mountains. This morning we were hearing different representatives from cities, how courage is needed, political courage, how parliaments are needed, stronger regulation, and this is the one that will determine somehow how much political courage is behind to move forward all these decisions. We all know that many of the people that are here today have participated on those guidelines from the WHO about air quality. These guidelines, these standards that frame what is our ideal, what would we want for people to breathe and not affecting their health and not killing them. This has been like our benchmark, but now we want that these guidelines will be around all countries and can be a reality. For this, we need the academia here represented, the people from universities, scientists. We need all the mayors, all those representatives from the local power that can provide so much support multisectorially. We need the civil society, those activists that have contributed to be here today. Of course, we need governments, we need United Nations, we need multilateralism, and we need the all to be together for this to be a reality. The good thing is that it can be a reality. It can be possible. We can save lungs, cardiovascular system. We can save the brain of all of our populations. We can reduce this toxicity in the air we breathe. But for this, we need willingness. We need political willingness. This is why your presence today somehow gives us a stronger strength, because we all know that when we are taking smart decisions with ambition, here we can be sure that our goal that somehow is called ambitious, I don't think we'll never be so ambitious when we are trying to save lives. We want at least, we want to reduce mortality. 50% of mortality for 2040 and for 2040, and this will require a lot of willingness, a lot of ambition, and of course all of us need to remember about the faces of those asthma children and the suffering of your patients that are hospitalized, or those who have died because they did not have this opportunity to have something so normal as breathing an air that will not kill us. We not want for air to kill us. Mr. President, there are no financial arguments against. Yesterday, we saw how China shared with us that they have taken measures, strong measures, on reducing this air pollution. And this has not represented any harm on their financial development. So here, we want to encourage you to your great effort. We want to acknowledge all who have contributed. My team, the best of the world, thank you so much. And most of all, thank Colombia for this magic realism of Colombia, of Cartagena. We are also contagious and we are so realistic, but we want to do more. We want to do magic. So Cartagena will be our starting point for this magic realism that we want to transform amongst everyone. Thank you so much. Thank you, Dr. Maria. Now we want to invite the representative from the Pan-American Health Organization in Colombia, Ms. Gina Tambini Gomez. Good afternoon, each one of you. Excellent. Mr. President Gustavo Petro, it's an honor for us receiving you in this second global conference about air pollution and health. Minister of Health, Mr. Jaramillo, a pleasure having you here with us. We acknowledge in the room Mr. Superintendent of Health, Mr. Vice Minister from the Ministry of Environment, Mr. Mauricio Cabrera. Thank you so much for being here with us today. I salute all of our colleagues, Rosamund Adu, who brings an important testimony that has touched us so many feelings and has strengthened the commitment to reduce that impact on health about the air pollution. Mr. Javier Padilla, Secretary of State for Health in Spain. It's a pleasure, most of all in that association that we have with Spain, with the countries of the region. We appreciate so much Ms. Andy Rodriguez, and our friend and colleague, Dr. Maria Neira, Director of Sanitary Health from the WHO. As Maria was saying, Mr. President and colleagues, there have been many years, I think we both have many years working for this World Health Organization and the Pan-American Health Organization. It is aiming multilateral and work done by everyone, by all delegates, all representatives, academia, grassroots organizations, civil society, with whom we can move forward to obtain and to have this goal to reduce health impact in 50% for 2040. Mr. President, we acknowledge your leadership and commitment to face air pollution and protect health and well-being of population. It demonstrates that being you here today, and as you have heard, a setting which is a complex setting with great challenges that this beautiful country has. Colombia is positioning itself as one of the leading countries in Latin America responding air pollution. We want to highlight that Colombia acknowledges the air quality as a national interest with the leadership of the Ministry of Health, of the Ministry of Environment, and the active participation of a Ministry of Mines, Energy, territorial entities, local entities. Actions are implemented that address the atmospheric pollution. Thanks for accepting hosting this second global conference about air pollution and health. This conference is driving conversations really fruitful that will have concrete outcomes that will strengthen the world and global action, to have that road in order to reinforce the cooperation between countries and the regions around the world, keeping this investment and political willingness at all levels. Data are redundant and relevant, as we listened in the previous interventions. 7 million of people die every year due to the exposure and air pollution. In Latin America and the Caribbean, there are more than 367,000 deaths every year. And in Colombia, we were hearing by Mr. Vice Minister this morning in the press conference, more than 7,000 deaths in the last figure that we have available. Deaths, premature deaths that can be preventable. Also concrete data, more than 5 million people in Colombia depend on biomass or wood to cook, which expose them to pollutants, especially in rural areas. Vulnerable populations, indigenous people, low-income populations are the most affected. In Latin America and the Caribbean, 70 million people depend on wood as an energy source for cooking. So therefore, all of these efforts that we are doing will have a strong impact to have equity in health, so we can really take that right for health that is so required. The countries around the region in Americas have approved the action plan for the region about health and air quality that follows the roadmap that has been updated by WHO. We acknowledge the approach for these topics in Colombia, most of all within your program, Mr. President, to be able to find social justice and environment justice as well as financial justice, which is coherent with that spirit of this global conference. This conference represents a fundamental weight towards a cleaner future and healthier future, addressing challenges such as the air pollution, climate change, equity in health, providing national solutions, building solutions regionally and internationally. These days, we have been able to visibilize the efforts of all the delegations present today with the goal of reducing the health impact of the air pollution for 2040. Mr. President, we have and we count on your leadership. We count on your commitment that has been done for you being here today. We know what is going on in the country, and we are really with you, supporting you to continue working together with this peace, the total peace that we all want.
Muchas gracias, señora Tam.
Thank you so much, Dr. Tambini. Now we want to invite the Secretary of State for Health, Mr. Javier Padilla Bernaldez.
Presidente.
Mr. President, Minister, authorities, and people in the civil society scope, professional health institutions. The truth is that for me, it's a great pleasure being here with all of you. And also, it's a pleasure adding value to celebrate an event like this. I think that the moments that from some parts of the world we are doubting the importance of multilateralism is especially relevant to reivindicate this multilateralism as a way of common dialogue, common house where we all make decisions in order to move forward together. Also, as a Secretary of State for Health in Spain, I want to reiterate our total and absolute support to the World Health Organization and our firm commitment with this organization, knowing that this is the World Health Organization, the organization that better supports in advancing health for the population, globally speaking. We are totally convinced that if WHO would not exist, of course, we should invent it. I think that there are not many things that we can do all together. Breathe is one of them, but also we need to breathe. Nobody are going to be exposed to that same risks. Therefore, it's especially important to say that the actions that we take will need those actions to get to population to be universal, but with a universalism scope, focusing on those collective and groups of population that are facing to greater risks, having a worse air quality there where they live. So you all know, especially for those who works in the in health scope, that whenever we want to move something forward, we need the argument health on top of the table is something effective. Health is the driver to change things, not only individually, but also collectively. This is why it's so important. We need to be aware about what is the challenge we have ahead of us. Yes, in 20th century, one of the most important changes and transformations in public health that brought more hope, life hope, and reduction of mortality were related to the drinking water. I think that we might say that the great challenge for public health in 21st century has to do with breathing air, drinking water, to breathing air. This is the transformation challenge we are facing right now. To conclude, I want to insist that the air quality policies facing climate change are especially relevant at times where we have many governments looking other places, and it seems to tell us that we need to relax our ambition in everything related to climate change and the ecological transition. Having speeches to try to hide that we have the need to act now and today in the climate change reach is tremendously ineffective. We can say that nobody is sure and safe in a wild or fire, if nobody is safe, if not breathing good quality air. But with no further ado, in this week, in this day that the European Commission are giving and providing recommendations to create survival kits, I think we can say that here from this conference, we could have a good kit, survival kit in terms of air quality, because we need in this kit governments, courageous governments that commit themselves to clean air for everyone, and we also need sanitary, universal health systems to prevent disease and to restitute and substitute health. With no further ado, thank you so much.
Muchas gracias.
Thank you so much to Mr. Padilla. Now we are going to listen to the founder and director, Ella Roberta, Ms. Rosamund Ado Kisi Debra. She's the Breathe Life voice for Ella Roberta Foundation.
His Excellency, thank you very much for having me, and to all the community for flying out to this beautiful country. Somebody recently told me they thought the public, citizens of countries, do not care about air pollution. It's not something on their radar. They care about water, they care about jobs. But breathing is the most fundamental right that we all deserve. Try not breathing for 2 minutes and see what happens to you. There are always excuses. People don't want to give up their cars, they don't want to use buses, they don't want to stop cooking indoors, or they don't want to stop wood burning. That is not true. The marginalized and the poorest need help. They have been fighting for so long, and it is incredibly difficult for them to actually do anything about these difficult decisions. One thing I know is citizens of the world do care about air pollution. They care about health. People generally care about health. Once you lose it, you can never regain it. Air pollution affects us all the way from the cradle unto the grave. And we have lots of data now showing us. What I am most struck by at this conference is Dr. Kuma talking about the women who are non-smokers, 40% of them, and who now have lung cancer. The child who has asthma, the child who has pneumonia, the child who has bronchitis, the child who can't breathe, and when you go into a hospital, they're on a nebulizer. It is not their fault. All our healthcare systems around the world are actually overstretched. People are scared for their families that when they need help, they aren't able to gain it. What do all of these illnesses have in common? We have heard here how air pollution affects every organ in the body. I consider this a global health pandemic. We are actually living in a public health crisis. And what is needed is very similar to the response to COVID-19. Air pollution calls for world leaders to act on a coordinated basis, a cross-border basis, in response to the clean air we share. Air pollution has no borders. There is an urgency. We have heard from Tedros that we need to halve air pollution by 50% by 2040. This will save millions of lives. This will also reduce healthcare costs. The health damages linked to PM 2.5 amounted to 8 trillion in 2019. Imagine what we could do with that money. We could feed the starving, education, and we could improve our health services. I am here to tell you that it is possible, there is a solution, and it is something we should all share. To clean up the air isn't easy, far from it, but it is something we should all do. To actually do nothing will be unforgivable. We live in an age of popularism in politics. In every country, if the public aren't shouting about something, it gives the decision makers an actual easy path to actually do nothing. What do we need to do? We need to monitor, we need to educate, and we need to raise awareness. We need to take people along with us on this journey of change. And we need people of countries to be loud. I call upon doctors, nurses, and people in health to actually treat your patients alone is not sufficient. You need to be advocates for your patients. You need to tell the politician that this matters. You know that unless they clean up the air, nothing much is going to be changed, and you are already overworked. The reason why I am here today is to give you the message: do not look away. Do not take the easy road. Do not sit back and do nothing. Clean up the air we actually breathe. It should be the #1 priority for all governments. It is a preventative strategy. We don't want people getting ill in the first place. We need the political will to do what is right. My family, we paid the ultimate price for inaction. We now know that if something was done, my daughter would actually be here now. We don't need many more millions of children to die before we actually do something. So what Ella would tell me is the pain she went through, no child needs to go through that pain. And it is every child's human right to be able to breathe clean air. So I am determined to keep on talking about my daughter who suffered, and to wake people up, to put pressure on those in power to please make meaningful changes for the health of all the children in the world. We must never, ever, ever give up. Thank you.
Muchísimas gracias, señora Rosamund.
Thank you so much, Ms. Rosamund Adu. Ladies and gentlemen, Mr. President Gustavo Petro, President of Colombia, will say his words right now to the auditory.
Directora del Departamento.
Director of the Department of Environment, Climate Change and Health from the WHO, Maria Neida. Representatives from the World Health Organization and the Pan American Health Organization in Colombia. Gina Tambini Gomez, Secretary of State of Health of Spain, Javier Padilla, founder and director of the Ela Roberta Foundation, Rosamond, General Secretary of the Presidency of the Republic, Ms. Fajardo, Minister of Health and Social Protection, Guillermo Alfonso Jaramillo Martinez, Ambassador of the Kingdom of Norway. A very special greetings to the international representatives of the 60 countries in attendance at this conference, and those of you who you represented by the World Health Organization and the Pan American Health Organization in Colombia, functionaries of the national government, members of the local government of Cartagena, national labor of national workers in the health sector and social security, integral social security workers, the educational community of Cartagena, and in general, all of you who are here with us today. You arrived at a moment or in the midst of a heated public debate which involves many people in Colombia about public health, including sabotage. They are preventing the sale of essential medications which are vital, such as insulin, so that the National Congress won't approve a reform to the health system, which will end particular businesses in a budget which is not that high, and then support a model. That's what they are trying to tear down into a preventive system, just like the Almar Conference of 1962, I believe it was. So it is interesting. The context is interesting when this conference takes place. And then I will explain some brief points of how can we not touch upon some which I deem important from the Colombian experience to the world in the topics that you have mentioned in previous presentations. No doubt we are, before anything else, in a the crisis of multilateralism, just like the Minister of Health said, the Spanish minister said, this is serious. It is not a matter for discussion, obviously, but we could be holding one of the last meetings of the World Health Organization, the intent of building something else in different countries to build a common agenda. Talk is made here about the OBG goals. Colombia says that it has 58%, and I want to re-examine that figure. But 58% is low from here to 2030. And will they be enough for the world? Or which world will we have by 2030, in about 5 years? Only 5 years. If one were to project what is happening today in the world, well, the multilateralism won't exist in 5 years, then all of this that we are doing could be left up in the air. Because behind it, there are political agendas, not only technical. And the political agendas shed light on world agendas. If there is no multilateralism, there is no common agenda, and there is no consensual base relative between the various civilizations of the world, that is the human diversity, to build those common goals. In a way, to do away with multilateralism, that is, with this custom born in the 20th century of finding, for the time being, between the states, should be between peoples, which is a higher scale, that these be in danger means that what is in danger is the common agenda and therefore the common well-being. It is an objective in its final stage. I will name it so. A deeply neoliberal, because this ideology became the dominant ideology, and ideology is different from science, is the opposite of science. To be science is the reality. So in terms of concept, I mean that ideology is not only a system of ideas. There are systems of scientific ideas, but rather a system of ideas that that twists reality, and that it is not scientific. That it goes into the decision of the irrationalism, which always, as George Lucas, the famous philosopher, said, it is the step prior to fascism. You have to not think to be fascist, and if you think about it, if you think, then you're not fascist. So the thoughts are contradictory for an essential reason. Fascism is a crime and not a policy. That is why one cannot tolerate fascism, but today it is in power in the world, especially because it has accessed the most powerful countries in the world, especially because in these most powerful countries in the world, migration that grows by the climate crisis and the wars that they themselves have caused, like, for instance, the blockade of Venezuela pushed millions of Venezuelans to this country. It produced a shock here, but it kept on going south and then on to the United States. And so more of the same. What will it produce? More of the same. More migration. Now I will have a delegate of the Trump administration, but we will touch upon the matter because we are repeating what humanity has already done. And when history repeats itself and we know of its consequences, then we are making the biggest of irrationalities to break up multilateralism, led us to the Second World War and the Nazis. And today we are breaking multilateralism. And therefore, we need to get ready, because it is not merely stating it, but we need to act against it. We need to set the common agenda and act accordingly, and act based on that common agenda. Why does multilateralism break up? Because a vision wants to be imposed over the entire humanity. Multilateralism doesn't work because it is a common vision, and a unilateral hegemonic vision is required. Then we need to break multilateralism, and that is what we are witnessing. We are going towards a somewhat controlling world, as George Orwell said in 1984, and each will act according to this new reality. One of the victims of this new reality is health. The COVID left us with a huge lesson, and most of you present, some more, some less, a lot died. If you take the crime rate, that is the death rate, because well, there were homicides also there because of COVID. In COVID, per every 100,000 inhabitants, you look at it in the world geography, we have a reality of just one indicator does not measure the efficiency of a health system. But why is Latin America below the world average when its population was relatively younger than the world average? Well, COVID affected the population, the older population relatively, than the younger one. But why Latin America, being relatively younger in the world, or than the humanity, had a higher rate, a death rate by COVID than the world average of young people? And one could not say that the health system are not working. And even this comparison I made in Italy, which is where COVID caught me, why the COVID death rate in Latin America is higher, when the center and the south of Italy is wealthier, more affluent. But the virus didn't respect the wallet. It respected where there were stronger preventive health systems. That's where it respected. And that lesson we failed to learn. That is, to resist not only the previous viruses, but the newer viruses that are coming due to the action of climate change. Then it will depend on our health systems, but above all, on its preventive capacity. But there's a problem. Even though there's a popular saying here that says that prevent is better than curing, in prevention there is no business, because it does away with the business, the market. The market is on the disease and not on the disease, on the prevention of the disease. And that is what is being debated in Colombia today, because what we have proposed is a change in health system toward a strong preventive system before anything. But since the prevention reduces disease, and here we're talking about diseases arising from, for instance, air pollution, a preventive season, which we refer to it as the social determinant of preventive health. Well, healthy water, nutrition, physical exercise, and clean air. That is a fundamental part of the preventive part. And then how will the health personnel go to each house? How do we make it so in Colombia? And it is hard in Colombia, especially because of the social inequality that exists. And you are in one of the most unequal cities of the world. And whoever comes to the center from the jet set, they like the church, and then they have a great house which is worth millions. But then they work a few steps further away from the center, from the walled city, and they'll witness the most abject poverty that you can see. Well, in that unequal society, how can a physician reach each home? And it is not because, if not because the state guarantees it, because the public's power and the public finances will guarantee it, because starting from the market, the physician will go where the millionaire Dutchess live and where the ATMs are, but it will not go to the poor neighborhoods, the neighborhoods of the slaves. But the elite who have governed and made the laws in Colombia have not looked at the slave or their inheritors or the peasant yesterday in the Spanish Empire and their inheritors. No, but just the part of the population who has access to ATMs. In Colombia, hospitals and clinics, and the offices of the financial intermediaries of health exist, and they fight for the money, and they are placed there where the ATMs are located. So draw a map of the ATMs in Colombia, and then over it put a map of the private hospitals and clinics, which are the majority, and that you'll see that they're near the ATMs. It is a regulated market, and it has left outside or left behind a huge number of people, because the market does not guarantee a universal right. And even though the market does not deny, it is an immense error that market of itself should guarantee the fundamental rights of people, among them high life and health. And that is the debate in Colombia. Surely the bill of law will be rescued for the second time, which shows the big influence of what I refer to as vampire capitals in health among them, because Congress members, contrary to the Constitution of Colombia, received money from Spanish health companies, right? And so we would like to investigate that, the international flows of those resources, because they broke the Constitution of Colombia, they violated the Constitution of Colombia, and they are breaking the possibility that the right to health be guaranteed in this country. Now, vis-a-vis climate change is a disaster, because if the lesson from COVID-19 is to strengthen preventive systems to wait for the new pandemic that will come, we've already discovered one, not a pandemic, but an attempt by the yellow fever virus. The animals bearing the disease started to make their way up the climate areas, layers, you know. If it gets warmer, you know, the trees start to go up, and animals, you know, and they come into contact with human beings who had never been in contact with them, and they transmit their virus. And in the health of the Minister of Health, there appear the virus of yellow fever, killing animals, you know. Monkeys, we were able to stave it off even before it got to the humans. We just took preventive measures that weren't taken in Colombia before. This is not covered by the press because they're not interested in these things being known. But in a preventive system is fundamental, and that is the fight that we are given. And if we want to adapt to the climate crisis, we have to make every country in the world, rich or poor, that there be strong health preventive systems. In general, given that they are not businesses, well, they should be they are the responsibility of the public, and they use public funds. Now, if we go back to the topic of the conflict, which is an aspect of this, you cannot but talk about the content. Then we have to go to the matter of the air, and the matter of air has two things: to air as a global atmosphere and local air. Part of the atmosphere, but in a local point. The global has an immense problem. The greenhouse effects, which derive a specific and historic economic system. I've always rejected this multilateralism that tries to evade the causes. So yes, the planet is becoming warmer, but why? Well, because of humans. No, it's not true. It's not because of humans. The people in the poor neighborhood of Cartagena have nothing to do with that. Colombia actually has little to do with that. Latin America actually has little to do with that. It is not humanity who is at fault for the climate crisis. It is the big capital, the one who dominates the world, the one who is breaking multilateralism to impose itself over on a common agenda and then impose its particular agenda. And it all boils down to one word: greed. Greed that turns into a multi-billionaires, and it is like 5 or 6 on Earth. They come out on TV every day next to presidents of countries, and they tell them, well, if you don't pay attention to me, you won't even make it to social media. If that is so, then we are failing on how to solve today the main problem of humanity, which is the possibility of it becoming extinguished because of better. In fact, the climate crisis, a topic that is not of this conference, but I want to put it on the table because the grand expectation, the affectation to the air, which is the atmosphere, is that every time it has more contaminants that are diluted in the global whole of the atmosphere, and which have been referred to as green gas effects, which we call CO2 derivative, but it is as a byproduct of the industrial use of coal, petroleum, and gas. And petroleum, gas, and coal is that energy that is killing us. It is only good to make earnings, and that is why we're dying. So what are we to do? Well, there's the human reaction to the possibility of its extinguishment, and multilateralism has been severely wounded to solve that problem through a plan which has been repeated here 1,000 times: energy transition, decarbonization, etc. But since stated it in the United Nations, these technical words that sometimes the people do not understand, that decarbonization, that is to stop using coal, oil, and gas, to make the transit, therefore, from a fossil economy to a non-fossil economy, means a change in the power of the social relation of production, of forces of production. And so we believe that with a pretty declaration, with a politically correct language, the problem is solved. And we're already at COP30 and, well, Brazil, where nothing is happening. Every day, things move toward the extinguishment of life. The problem is political, and therefore, since it is political, it implies the action of humanity, and we want to correct the times of life, which in this case have become the times of death, or for death. And that is one point that was not a part of this conference, but I just leave it there in the air so that you can think of it. This conference contributes to the atmosphere at a local scale, which is also a problem, and which in the Colombian case, it remits us into that we are dying because of our own air, which is not Africa's, which is not Europe's, which is not Asia's. The air that we breathe specifically, we ourselves, those of us who live here. The indicator that I have is that 34 Colombians die out of 100,000 inhabitants due to diseases that deal with air pollution. Minister, 34 is much more than the Colombians who die by murder. Seen as Colombia, unfortunately still today, has one of the highest murder rates in the world. So the air that we breathe kills us more than violence in Colombia. And of course we have to ask ourselves why. Greed. Again, greed. The greed. Both the death from violence as well as the death from air, they die because of greed. Why? Because then in the causes of the air pollution, there are no natural reasons. One cannot blame humanity or the peoples of Colombia or he or she who cooks with wood. He is affected more locally if he cooks with wood, or she. But the contamination of the air in the big cities that is killing kids, babies, and older people is due to a business that was imposed on to this Latin American countries for decades that we even today have not been able to overcome. And the business of the transport. You can live, Cartagena is surrounded by water, but the use of its transport is a land transport, and these are diesel buses. You can observe and examine it. Their taxis, its taxis are diesel run, and there is an intensive use of the particular private vehicle, much more than what is needed in Cartagena, which are a petrol run. In other words, it's a fossil transport. If you go to Bogota, worse, because over there we have 8 million people, and there is no electrical metro. The only means of electric means of transportation that exists in Bogota is a very old railroad. What's the name of it? It goes up to Montserrat. The trolley cart. The trolley cart in Catalonia. It's a tram card. And the other, I installed it, which is a cable in Bolivar, which we call Metro Cable but it is not referred to as Metrocable Transicable because the transport is a business in Bogota around the bus hubs, diesel-run bus hubs, and 3 private operators who practically manage that deal. And so they talk and talk. The media say that that was a modern wonder of the city, and we're killing ourselves. Medellin, with more responsibility of the political elite, it made more progress of the Colombian cities. They advanced to multimodality and electric transport, and electric transport in terms of air is good. Now, the struggle for an underground metro almost cost me my life. More than a decade we have been at it, and we're losing. The metro that was made in Bogota is weak. So what they do is make more roads for buses, diesel-run buses. We are looking for, and that is our proposal here, a priority program referred to as, which through an administrative technology will allow us to fund from the national government the purchasing of the diesel buses of the large cities in Colombia, including Bogota, which was proposed by the mayor, to transform those into electric, to transform those into electric tram cars or electric vehicles, to then drive most transport, because most transport, the majority of the fleet in Colombia is a particular vehicle, so that from the particular use we will go into the mass transit use or transport use. So it is not about broadening avenues. I had a good debate. It's just that he talked about it in judicial terms, and so I had to judicialize the theory of Nobel Peace Laureate for 1951 in the United States, who said that if avenues are broadened in cities, the only thing it does is to promote the urban development and the greater use of the car, and not decongest. Decongestion consists of using not particular or fewer particular cases, because the mass transport system is more comfortable. But it is more comfortable only if it starts by not killing children and older people, and that implies electric transportation or electric vehicles. Colombia does not have it. Our grandparents installed it, but our governing merchants did away with it. And today we have this death rate that is higher than the death rate due to violence in Colombia. Minister of Health. It is linked to the preventive health system. To clean the air in Colombia means to reduce particular businesses around transportation and a chronic transport that we have in Colombia. And so this is a program that we need to implement locally, but which nationally can be stimulated if the ANI gets to it, and we are able to manage that. The strategic project for mass electric transport system can be generated nationwide, so that we might start setting money away, so that we year by year might then be able to pay and purchase those buses that are killing children and other people year to year because of the contamination. I had more topics to talk, but I don't. You have your own time, and I don't want to rob you of it. I hopefully, the ideas that I've mentioned, I will touch upon one last one. Because of the world implication, because it has. So these matters are local, but anything that is done anywhere affects the whole. The Amazon is one of the pillars of the world. If that forest ends, then we will have reached a point of no return, not for the Colombian population, but the entire humanity. Thus, multilateralism is important. I had been in my administration a year and a half, and I proposed a common financial solution to solve the problem with ending in the Amazon, it's being ended faster in Brazil than in Colombia. Even the armed groups believe that the land that is not as fertile land after it is burned is less fertile than the planted trees, but it is ignorance. This is also because of a lack of an agrarian reform which prevented peasants from having productive lands. That is why you'll be able to see big fertile extensions next to the port with 2 or 3 cows working in each hectare, completely underutilized for the production of food, being capable of producing a lot of food for the Caribbean, because it doesn't have fertile land. But the feudal vision that we were left with has been, so the peasants had been shifting toward the higher land where we have our water springs, or toward the jungle. Part of drug traffic, it has to do with that, not because the peasants are drug traffickers, but because merchants could use this reality in Colombia. And forests have been breaking up to the point that a city like Bogota, our capital, with 9 million people, the entire savannah of Bogota, which is one of the prettiest regions in the world, today sees its water being rationed at a growing pace. Why? Because the Amazon brought through the water vapor that came out through the millions and millions of leaves, and rivers have just flown away. So the rivers collapsed onto the atmosphere, and they got to a system that we call highlands, where its little droplets again evaporate into the liquid, and that was the water for 9 million. And since the forests were burned, a shift occurred toward the west, ever more to the east, ever further from the Cordillera of Bogota. So what happened? 9 million people today in the entire savannah of Bogota have to go and to the bathroom with a water container, and so they are being rationed water for 1 day. So what they do is purchase water the day before, so that during the ration day they can use water, and we have ever less water. In terms of trends in time, the big city of Bogota could practically die as one of the big cities of the world, which is dying currently on Earth. Cause? Well, solution? Replant the Amazon towards the eastern Cordillera. Who helps us? How much is that worth? What are the economic and power structures that today need to be changed to be able to plant the forest, revitalizing it again towards the eastern Cordillera, so that a city of 9 million people and its vicinities might have water again? Look at the complexity of the climate crisis, because next to that greed that burns and chops the forest, now the very heat of the atmosphere burns the forest. So by getting warmer within the atmosphere, well, the forest burns more, and the Amazon, if the Amazon forest burns, not only Bogota will be left without water, but the entire humanity will lose its third climate pillar, and it'll go into a point of no return in the environmental atmospheric destruction of climate, which would imply a substantial progress of disease on the one side, and the extinction of humanity on the other. The extinction of humanity will not be the cause of the seas rising or hurricanes stronger every time. The extinction of humanity will be because of disease. And disease resulting from invisible bugs, which we call viruses, which we are opening up as the climate cycle is deadly injured. Thank you very much, Mr. President.
Señor, los miembros de
Mr. President, for all of you and all the conference speakers, we want please so you to be here to take a picture of this high-level meeting from the second global conference about air pollution and health. Well, for all the attendees and the ones that went with us in streaming, we are ending this segment in the framework of the second Global Conference of Air Pollution and Health, organized and hosted by the WHO. Thank you so much, and get a rest of afternoon enjoyable for all of you. Thank you so much.
Perdóneme.